Well, my next guest has spent her entire professional career working to educate her patients and the public about breast health and breast cancers. Here to tell us about her upcoming free forum is Dr. Shahla Masood, pathologist and cryptopathologist at UF Health Jacksonville and medical director for the UF Health Breast Center. Good morning, Dr. Masood. Thank you for being here.
Good morning. Thank you for having me.
So you, as we mentioned, have really spent decades now, nearly 3 decades, doing this
Almost.
work.
Yes.
Um, and it has been a period of, advancement, great advancement in some cases when it comes to breast health and breast cancer. Can you tell us about what has changed in the time that you've been doing the work that you do?
Well, fundamentally, when you really look at breast cancer, this is a disease that has captured the attention of the whole world and is a major global breast health issue. As the result of that, there has been significant changes that has occurred in the diagnosis as well as treatment of breast cancer. So the concept that it used to be that breast cancer is a fatal disease, and if you get it, you're just done, is really has gone because of the fact that we have recognized that, first of all, breast cancer is not a single disease. Breast cancer is a disease that has multiple forms and shapes, and they are biologically very different from each other. So at the time that we thought that breast cancer is a single disease is gone. It has, multiple different breast cancer type that ranges from a very low grade cancer that if it is detected early, it is managed beautifully and the patient has a long life with no problem. There are a small percentage of breast cancers that they are associated with aggressive behavior. And these are the cases that we also can identify. And therefore, we make sure that they get the most advanced aggressive type of therapy that is available to them.
Are outcomes overall better when it comes to breast cancers? I mean, I know there's this category of early detected cancers, and those are probably easier to resolve or at least keep in remission. But do we have a sense overall as to whether it's become more survivable?
Absolutely. Breast cancer at the moment is a disease that, if detected early and is not aggressive, is practically looked at as a chronic disease. So, in that setting, there are right now millions of women that they're living with so called breast cancer, and we call it survivors. And the number of survivors all over the world has increased significantly because of the early detection and better therapy that is now available to them.
This forum that you put on really is aimed at the general public, and it's a very, nice event. There's a dinner served. It's a free event. You have to register, but it is a free event. And you have a range of disciplines that are represented there, including things like obviously radiation oncology, but also psychiatry. What are you aiming to present to people in terms of the various kind of medical expertise the experts that you bring in?
That's an excellent question because of the fact that, again, we have learned that as breast cancer is not a single disease that can be taken care by a single physician, there is multidisciplinary effort of a group of physicians in different disciplines that they need to take care of a patient with breast cancer. That includes pathologists, radiologists, surgeons, radiation oncologists, plastic surgeons, as well as the psychiatrists. And those people that also they are involved in risk assessment, so to speak, to try to define what kind of risk a woman has and what are the follow-up recommendation that can occur for patients that they are so-called at high risk. Therefore, the concept of breast center and breast programs have been coming on board for a long time right now, and there is a um, entity that we are calling it National Accreditation Program for Breast Centers, that they oversee that overall functions of different physicians that collectively put their mind to try to plan therapy for individual patients based on the character of the tumor of that individual patient.
It is a really, great advancement in the way that we approach and treat cancers. This session is called What Everyone Should Know About Breast Health. As we said, seating is limited, but registration begins on site Thursday, October 2nd at 5:30. It's at the Marriott Jacksonville downtown, and you can find a link to it on our website. Dr. Shahla Masood, thank you so much for being here.
Thank you for having me.
All
Thank
right.
you.